Welcome to Humanizing Healthcare, where we talk with innovators and thought leaders who are working to make healthcare experiences more compassionate and rewarding for all. Our host is Chris Malone, founder of Fidelum Health and author of the award-winning book, The Human Brand: How We Relate to People, Products, and Companies.
Welcome to Humanizing Healthcare Live. I'm Chris Malone, and I'll be your host for today's discussion. We are here at the International PX Congress in Abu Dhabi, United Arab Emirates, and I'm pleased to have with me today Dr. Aysha El Mehri, who is the Regional CEO for Burjeel Holdings. Welcome to the program, Dr. El Mehri.
You're most welcome. Thank you for hosting me in this podcast, and I'm happy to hear from you as well and ready to answer your questions.
Well, thank you so much. I'm wondering, is there a story you can share with us about how you chose a career in medicine and healthcare? How did all that come about for you?
Well, this is actually a family touch in terms of how I really went. And interestingly, I would like to reveal that I'm a nurse by origin in my profession. And this is when I encountered personally to take care of my father when he went to a heart attack, and looking to a trustful person who can take care of him. And he had that huge trust on me that I'm the eldest in the family and I can take care of him. And then something that reveals that either you should be a physician or a nurse. And the path just paved me the road to be a nurse, and I'm proud to be a nurse by profession.
Well, we're so pleased that you made that choice and the positive impact that you're having.
Thank you.
Now, in your role as regional CEO at Burjeel, what does that entail? What kinds of things are you engaged in, and how are you supporting the organization?
The role is, let me explain to you that the cluster that I'm handling, which is in Al Ain. And Al Ain, there are many of the units that are kind of a cluster of different from the aspect of the hospitals, including primary care and the day surgery centers, and there are additional of the kind of projects that we are working. By default, anybody, if he will hear that as a CEO, immediately it comes in his mind that it's just managing the P&L and managing the profits and revenue. In fact, that's not the truth. The truth is that it is in all aspects that I'm engaged with the team, starting from the clinical care, clinical outcome, patient journeys, patient experience, making sure that the objective and the goals of the organization has been achieved, making the brand and reputation that we are the trustworthy organization that the patient can come having a confidence that we can provide the care. So there are different elements that managing at the same time. In addition, it's managing the workforce, and they are not just simple. It's not purely physicians or the nurses. Starting from the big head of department or the medical director, going into the security who is actually guarding our gate. So this is where my main stakeholders that I need to take care of them, manage them, and make sure that we are all aligned, having the same vision and the direction aligned, with the expectation of the bigger umbrella of the organization.
Well, you gave a very compelling presentation at the conference here this morning about empowered teams and transformed outcomes. It really sounds like you're focused on that team engagement. But you could tell us a little bit more about your presentation for those that didn't hear it this morning.
So I wanted really to give a concept which is a bit quite new. The concept of the patient experience by default going on as a trendy that we have to have a high score in the patient satisfaction. Everybody should fill the surveys, and at the same time maybe we can add a few fancy things to provide a good care. I wanted really to give a concept and a belief on everybody in that venue that if we are handling the patient experience and in addition of the staff experience together, will give us and to lead us into the healthy economics, and it will sustain the organization regardless of whatever the challenges we are going to face currently or in the future. And based into a lot of the evidence base and research, it has been found that if the two elements had been handled in the right way, looking into the measurable outcome and the KPIs, monitoring the process and the patient journey, but at the same time, you don't ignore the staff expectation, you are going to go with the healthy economics. That's what I tried really to present and to help the attendees to take that concept, because it's no anymore something nice to have, and it's no anymore expensive to have.
No, that's a great point. And our work has also found that the staff experience, especially in that engagement for them, that's the emotional fuel that they need to bring to their work every day to be able to deliver a great patient experience. And so the fact that you've got to have both of those in order to get the patient outcome is really critical.
I agree.
Are there any particular initiatives or programs that you have in place or could share that others might be interested in as to how you're building up your staff engagement?
So we have two categories of the staff. So we have the clinical staff and at the same time the other supportive staff, and that's include the admin and the administration. Now, one of the gap in the healthcare sectors, the group of the team who are running the admin work, they lack actually the understanding of the clinical acumen. And that's where is the challenge to understand what is the patient's need and the patient expectation. On the other side, the clinical team. So the clinical team always would like really wanted to have a kind of an autonomy in driving and delivering the patient care. So these two, domain need to be. I wanted to make sure that it has been fulfilled. How it will be? So gather everybody in one room. It will be a good exposure for the non-clinical team to understand and to gain the clinical acumen, and at the same time giving the upper hand and at the same time the autonomy for the clinical team. Mainly we talk about the physician and the nursing by saying that led by practice. Right. And to have that kind of building and reinforcing just culture. So that means all of us are professional, all of us are serving for the patient, but it is the gap of understanding and digesting these kind of the jargons and the terminologies. So we are building that bridge, and this is an initiative led by starting doing with the morning huddle.
Oh, excellent.
And that morning huddle is helping. So the non-clinical team starting the clinical acumen, and the clinical team started to understand what are the operational and the financial acumen. So all will be having the same direction. Everybody will be in the same page.
Excellent. And I think you mentioned something really important. That is that, the administrative staff is not as familiar with the clinical, and the clinical staff is not as familiar with the administrative responsibilities. But that particularly on the clinical side, yes, they have to do all of the medical things a particular way, but helping them understand the significance of the culture and the social and the emotional part of it, I think can be really valuable as well, so that you get that culture where everyone gets the emotional fuel that they need.
Correct. So it's like a bridge building between both of them.
Exactly. One of the underlying premises of this program is that the idea that as healthcare organizations have become larger, have become more digital, have become focused on metrics and process and efficiency and so forth, in some cases, care experiences have started to feel a little bit more like a transaction for patients and care providers. I'm wondering if you've seen anything like that in your organization. Our belief is that the relationship really matters, but it can be hard for a patient and a care provider to connect if it's such a busy, rushing environment.
It is. We are facing that in our day-to-day operation and in day-to-day interaction, and that's why there is always we need to provide a room for them to gain that knowledge and understanding and helping them to overcome these glitches. And that's why I mentioned today in the morning session. Everybody talks about the AI and the technologies, but somehow we are having a blind spot because sometimes we are bringing the technology that worsens the situation than really helping them. So we talk about the KPI and we don't ignore the data, and the AI is really important, but into which direction we have to navigate that. So when we bring that, especially for the nurse who are overwhelmed with the nurse-staff ratio, it's really a big challenge we are facing. The high turnover among the clinical team, even the turnover of the admin team, and this is because of the workload and the environmental pressure. So here it is where we need to enable them, helping them to introduce the automation and the AI and the technologies, but to ease their life more than to be complicated. And then after that we come with the KPI and the parameters that, oh, we didn't achieve it because you didn't do it. So that's the thing, and if it's every day.
That's right. I think you make an excellent point that, yes, we want to use AI to reduce the administrative burden, but we want to do that in such a way that we enable greater connection between colleagues and patients, not just help them get on to the next task. That's, I think, really critical. Now, you're engaged with lots of young and emerging leaders. Many are here at this conference. What advice would you have for them who might want to aspire to a regional CEO type role? Any words of wisdom that you could share for their benefit?
a message for everybody, and I keep saying that to myself because we are in the healthcare sector. We are not in the banking or a real estate sector. So we don't deal with the buildings and papers. We deal with the souls and the humans. And just to keep reminding ourselves, we are all here patient advocates. We are dealing with the souls. So the healing touch that sometimes we somehow, and I'm one of them, that we forgot. We need to keep reminding ourselves, get that healing touch. And we are there for the patients because that patient might be you yourself one day or somebody who is beloved and from your family. And I think with this, we will be successful, we'll be achieving. It's not an easy journey, mainly in the healthcare industry, especially post-COVID and pandemic. It reveals a lot of the challenges and the mandate and the expectation came in the healthcare. So you are not alone. We are all in that. We are all in that ship, but we are, together. Just don't forget your core mission. We are there for the clients and the patients.
That's excellent advice, not to lose sight of that. So our final question, and one of my favorites, is do you have a favorite quote you can share with us? And if so, why is it your favorite quote?
Yeah, well, this is, I always remind myself, it is a verses from the Holy Quran, that the God will never waste your effort. He watch your work, your effort. It's a good effort that you are doing and you will be rewarded. So never be demotivated or depressed. Or you think that with all the pressure that you are, especially in the healthcare providers, we face a lot of the pressure around us, either the physician or the nurse, a simple nurse in the ER, or a physician who is running in the ICU. Never think that you are forgotten. And just remember that phrase that Allah is rewarding you. This is a thing that you are doing for the human, and it will uplift your motivation and you come back with the good energy.
Excellent advice. Thank you so much. It's a real pleasure to talk to you, Dr. El Mehri. Thank you for joining us today.
It's my honor. Thank you.
Thank you for joining us today. Be sure to join us for another episode of Humanizing Healthcare, where we talk to another healthcare leader and innovator. Thanks very much.
Thanks for listening today. If you enjoyed this episode of Humanizing Healthcare, please give it a rating, share it with others, and follow us at Fidelum Health on LinkedIn. And make sure you join us next time as we share more insights from another inspiring healthcare leader and innovator.